Okay, we're going to get started with the afternoon session. So those of you that were with us earlier, we had the undergraduate track for the 2024 McGinnis Venture Competition, and we're about to head into the graduate track. Just so you know, the sort of ratio of graduate to undergraduate is about 2/3 to 1/3. So we're going to have about 10 teams pitch here in the afternoon. We have 2-minute breaks in between each of the pitches, and then we'll have a 10-minute break halfway through so you can get up, stretch your legs, use the facilities, what have you. We do have some refreshments on the tables behind you if you're thirsty or you've got a salt craving. So we'll do that. I'd like to thank the McGinnis family. We have 3 representatives. If you could raise your hands right here that endowed the McGinnis Endowment 25 years ago. 20 years ago, it was turned into an international competition. And 11 years ago, we thought we had enough great CMU startups that we focused it inward. In fact, the McGinnis Endowment allowed Carnegie Mellon to make the first ever investments in student startups here at Carnegie Mellon. That's only been happening for the last 11 years. So if we can give the McGinnis family a great big round of applause, thank you. Many of you know that CMU is an international school. We have campuses on the West Coast in Washington, D.C. and Australia. In the undergraduate track, we had a team piped in over the internet from Qatar at our Qatar campus. And the first 2 competitors in the graduate track are actually from CMU Africa, and we're going to be online. One of those teams was actually going to be here live, but they missed their planes. So it was really a sad situation. Yeah, we're sorry, really sorry about that. But we're really excited to have 2 teams from CMU Africa participate today. The first of which is called Plus Systems, and it's smart healthcare for all.
All right, thank you. Hope you can hear me. My name is Elvis.
And I'm Ivan.
And we are Plus Systems, a software company in Rwanda, founded in 2018 in the vibrant tech scene of Kigali. We aim to contribute to the digital transformation of the healthcare industry in Rwanda and Africa in general. Today, we are delighted to present to you our flagship product, Clinic Plus Pro, which is a data management system for healthcare facilities that collects data, everything from the reception to the vital signs to the consultation room, lab tests and results, do that with a comprehensive data analytics and insights tools. As we like to say, our Rwandan digital healthcare ecosystem is very special. I'll start by sharing some background on the data management footprint in Rwanda. We have 5% of healthcare facilities, usually large international hospitals, with self-optimized solutions tailored to their specific operational needs. They tend to be really, really expensive. We also have 15% of healthcare facilities, also pretty large hospitals, who utilizes third-party solutions, often world-renowned. They are still expensive for the local market, and they also tend to lack in local market customization and sometimes in technical support. That leaves us with the remaining 80%. We jokingly call it the jungle. It consists of 30% of healthcare facilities, mostly basically solutions downloaded from the web, and in few cases in-house built solutions. Although these are very affordable, and to be honest, they are in most cases free, they tend to lack in features, and there are also huge support and scalability issues in there. The remaining is 45% that relies solely on paper-based records and painful manual processes. With that in mind, and looking at the big picture, we have been able to identify 4 major challenges caused by lack of inadequate data management solution in our healthcare ecosystem. There's inefficiency and fragmentation of data. This is a big one. Delayed insurance reimbursement. This is caused by long verification and validation processes. There's a lack of seamless patient follow-up. There needs to be a unified single file per patient, and also quite understandably an insufficient data analysis and insights. All right, I'll let Ivan introduce the solution.
We present to you Clinic Plus Pro, our healthcare data management solution, which has the aim of bridging the digitization of the healthcare ecosystem in Rwanda. It enables easy access to patient record for both healthcare providers and insurance companies. Inventory management and replenishment, where hospitals get alerts when they're about to run out of stock and be able to order and replenish with medical supplies within our platform. without having to move from the facility. With this feature, we are aiming at solving the medical supply distribution channel problem, which is a very big one in this ecosystem. We integrated as well insurance payment processing to speed up insurance reimbursement, and we managed to speed up the reimbursement period from 90 plus days up to 14 and less. It has operational analytics for optimization and to reduce operational costs for healthcare facilities. Our aim is to improve the healthcare management in Africa. So we are aiming at leveraging AI and machine learning on the ends of predictive and preventive healthcare. We are actively working on the first ever social media platform tailored for healthcare professionals, facilitating collaborating medical research within the ecosystem and in Africa in general.
All right, we divide our market in three main categories. We have private and public healthcare facilities. These are our main customers. We account for 2,500 in Rwanda and around 130,000 in Africa. Our secondary customers are healthcare insurance providers. There are 16 major healthcare facilities in Rwanda, healthcare insurance facilities in Rwanda, and an estimated of 2,500 in Africa. We also intend to service medical suppliers as they can benefit from this digital transformation with stock alerts and replenishment capabilities. We estimate that there are over 50 major medical suppliers in Rwanda. Our revenue model, we also categorize it in three main revenue streams. We charge healthcare facilities a monthly subscription fee that ranges from 100 to 500 USD, depending on the size and feature. We also charge insurance companies a monthly subscription fee per integrated facility in the range of 50 to 100 USD. We also charge 1 to 1.5% on each successful sale from medical suppliers. Note that these prices are promotional and we are aiming for fast market penetration. Now for the competition, this is an overview of the competition.
Not muted. There you go. There we go. Okay, we're going to hand it over to the judges now for questions.
Yeah, 2 minutes. All right.
You mentioned you're using AI and machine learning for disease identification, prediction. Talk about that a little bit more.
All right. We're aiming to include AI and machine learning predictive analytics because we are in possession of a huge amount of data that could be used to these ends, and the technology have been shown to be existing already. We could leverage existing technology to do that.
Which of your target markets have you been able to make the most progress in?
All right.
Is it the large institutions, the small providers, the insurance companies, or the medical suppliers?
It's a bit scattered. We have 16 healthcare facilities. They are medium healthcare facilities in Rwanda and in DRC. That's 2 countries, and we have also been able to secure a long-lasting partnership with Sanlam, which is one of the leading insurance companies in Africa that spans into 32 countries, and a very big company. And they are we've been working together into integrating our system with theirs, and it's been working fine with our customer base. And now we are in talks of increasing these numbers to their partners.
So they have 800 and plus partners in Rwanda, and a very big number in Africa. So we are actively working on leveraging all that so that we can increase our number of subscribers.
Can you talk a little bit about your competitive landscape?
Okay, so basically it's divided as I did in an overview before. We have 5% that are large international hospitals. They use tailored specific solutions to their needs. And we have 15% that are large hospitals that use world-renowned third parties. But as you see, there is an 80% that has still lacks for advanced solution that would leverage the actual technologies. We have 45% that still use paper-based record and manual painful processes. It's a huge market. And also 35% are still use free solutions from the web and probably in-house solution that often gets abandoned and such.
Why did you choose to include inventory management? I sort of understand the EMR part and claims processing, but then to encompass into inventory management it's big to start, and that's huge.
Yeah. Okay.
So let me talk about it. So we included the inventory management. When you look at the ecosystem that we are working in, there is a huge gap when it comes to medicine and medical supplies distribution. Sometimes hospitals are remote, and other times the medicine are not in the same location. So you have to pinpoint and know exactly where the medicine is. So what we are going to do is we are going to be having the inventory of the medical suppliers and as well as the needs of the hospitals, and we'll be able to get a commission of on the sales from both of them and really be able to bridge the gap that is in the supply chain. Thank you.
I think we have time for one more question.
I think a quick one. So
Okay.
you've been going for 6 years and have 16 or 18 customers. What does your revenue
Yes.
look like?
So we are still 6 years have been priorly into making the product a reality. We started with pilot healthcare facilities with 2 of them in the beginning, perfected the product so it could fit the market, integrating all these solutions. And only in the last 2 years that we started getting good feedback and word of mouth got started us with more and more clients. We haven't really made any marketing campaign so far, but we are transitioning into it with maybe a more aggressive marketing and get to more people. Yeah.
Super. Thank you very much. Thank you, gentlemen. We appreciate it.
Okay. Thank you.